everybody. This is part 2 of our acute abdomen and pelvis series. We went over a couple cases in the prior video, and in this video we'll go over the answers for the cases. Some of these are acute conditions, others are signs that indicate impending acute condition. The first couple cases are regarding the aorta, and here we see a large abdominal aortic aneurysm with some fissuring of the mural thrombus indicating an impending aortic rupture. Here we have another case of abdominal aortic aneurysm, and the most important finding here, there is some degree of small bowel obstruction as well, but here we see this crescentic hyperdensity along the wall of the aneurysm, and this is another sign of impending aortic aneurysm rupture. This is an example of a ruptured aneurysm. Here again we see these kind of concentric layers of hyperdense material. We see the tangential calcium sign indicating compromise of the vascular wall, and we see blood products extending into the retroperitoneal space on the right. This is abdominal aortic rupture. Another example of the tangential calcium sign. This is the draped aorta sign, also indicating compromise of the integrity of the vessel wall. The wall should normally contain the contents and have some integrity to it, but the wall is now conforming to contours of adjacent structures. So this implies compromise of the integrity of the vascular wall and is indicative of impending aortic rupture. The finding here is again with the aorta, and we can see some gas within the aortic wall, and this is an example of aortoenteric fistula, and specifically involving the duodenum. Similar findings can also be seen in the setting of infection if there is a aortic graft, but we don't see a graft here. Here we have some irregular contour of the aorta and a lot of soft tissue density here with some fatty stranding around it. This is an example of an aortic mycotic aneurysm. Here we have some narrowing and wall thickening of the mid-abdominal aorta without any significant surrounding changes, and this was due to a vasculitis, specifically Behçet syndrome. This is a case of mid-aortic syndrome, and it is this developmental narrowing of the mid-abdominal aorta. You can see there isn't really any wall thickening or any surrounding changes. This is thought to be due to an insult during gestation. This is a case of spontaneous rupture of a hepatocellular carcinoma. Here we can see the hyperattenuating mass within the liver with some central necrosis, and we can see mixed density material along the dome of the liver compatible with acute rupture. This is a case of penetrating injury, and over here we can see the laceration or the penetrating injury here, and slightly superior to this we can see a laceration of the liver and of the kidney. So this is an example of penetrating trauma with solid organ lacerations. This case involved 2 image sets, and this is in the venous phase, and the finding is with the left kidney we can see some material around the left kidney and some contrast material appearing to layer in this region over here. And on delayed images, we can see that there's an increased amount of material outside of the collecting system and also surrounding the kidney. So this is a case of traumatic urine leak. This is a case of splenic infarct. Here is a subtle case of pancreatic laceration, and what should have caught your attention was this soft tissue induration over here, and immediately adjacent, this subtle linear hypodensity extending across the pancreas. This is another pancreatic laceration case, a little more obvious, and we can see a focal, somewhat linear defect to the body of the pancreas. The most important thing to assess for here is the integrity of the main pancreatic duct. It's difficult to look for on CT, and usually these patients will get an MRCP to evaluate that. This is a case of a Tubo-Ovarian Abscess. We have a multi-septated rim-enhancing mass within the pelvis. This is an example of a chance fracture involving all three columns of the spine. This is an unstable fracture. This was an example of a right adrenal hemorrhage. We can see here the normal appearing slightly thickened but not overtly abnormal left adrenal gland, and the right adrenal gland, we can see the base here. We can see maybe one, maybe both limbs here, but there's a large amount of material, hyperdense material extending from the adrenal gland, and we can see that the inferior kidney is normal. So this is a right adrenal hemorrhage. This was a case of colonic intussusception, and we can see here, I followed it through, but you'll just have to believe me that the descending colon, distal portion, is here, and this is all intussusception of the large bowel extending to the cecum, and this was secondary to a cecal adenocarcinoma. This is our last case, the pelvis, and we can see some soft tissue induration extending from the anterior pelvic wall into the perineum with some subcutaneous emphysema over here, and this is necrotizing fasciitis, and in this region it's also known as Fournier's gangrene. So that's the end of the video. If you liked it, give it a thumbs up. Let me know how many of these you got right, and if you want to see more of these videos, then subscribe to the channel. Thank you.